Now we're going to see the internal versus external hemorrhoids. Remember, here we have the pectin line. The arterial supply here is the superior rectal artery. The vein will be the superior rectal vein that drains to the inferior mesenteric vein, and then the splenic vein, and then the portal vein. Here below the pectin line, we have the inferior and middle rectal arteries, inferior and middle rectal veins. So below the pectin line, we have the external hemorrhoids, and above the pectin line, the internal hemorrhoids. So here we will have these tortuosity blood vessels, congested blood vessels, because the innervation of the internal hemorrhoids is visceral innervation. Then the internal hemorrhoids are not painful. And in the external hemorrhoids, below the pectin line, the sensation is by the pudendal nerve. This is somatic innervation, so the external hemorrhoids are painful. Next, the presentation of the hemorrhoids could be bleeding. Most commonly would be a hematochezia, sometimes pain. The treatment would be medical treatment. We want to increase the fiber use, decreasing the time of being seated on the toilet. We will use stool softeners, seat baths. If anything of this doesn't work, then we do rubber band ligation of the internal hemorrhoids. And if this doesn't work, then the surgical removal. And if we have external acute thrombosis of the external hemorrhoids, this is within 3 days, then we can do surgery or embolectomy. Otherwise, this would be medical treatment. So the most important thing is that the internal hemorrhoids are not painful, and the external hemorrhoids are painful. And the most accurate test of this would be anoscopy. Remember that in every anal lesion and bleeding problem, lower gastrointestinal bleeding, that is in every patient with hematochezia, we need to do an anoscopy in order to rule out external or internal hemorrhoids.